Hey, good morning, everybody, and welcome to the Violence Prevention Strategies webinar for social services sector in BC. My name is Tigran Bajgoric, and I'm the CEO of the Community Social Services Health and Safety Association. I'm excited to have you all with us today, and as we explore violence prevention, a topic of interest in our sector. Before we get started, I would like to cover a few items. This webinar is being recorded. This webinar will be posted to our website after, as well as to our YouTube channel. I invite all of you to visit our updated website and sign up for our newsletter if you haven't done so already. And why don't we get started? So first of all, now as we get started, I want to acknowledge the unceded lands of more than 200 distinct First Nations in British Columbia. Myself, I'm calling in from the Musqueam traditional territories of the Musqueam, Tsleil-Waututh, and Squamish First Nations. In our work and in our lives, we are committed to listening and learning, to truth and reconciliation, and to finding better ways of being on this land, and to incorporating this work into our health and safety programs. So as we get started, I first want to introduce our panelists. With us today, we have some industry experts from our advisory panel, and we have employer representatives from different organizations. So first of all, we have Farzad Kassad, who is a Senior Labor Relations Officer with the Health and Safety Association. We have Geri Grigg, Occupational Health and Safety Representative from the Health Employers Union. We have Kavita Kamat, who is a Clinical Director with Laurel Behavior Support Services and Possibilities, and myself, Tigran, with the Health and Safety Association. And Anna, who is helping us with the logistics of this event. So welcome, everybody. These are our panelists. A little bit about us. So as we get started, many of you already know that you're members of our organization. If you're registered with WorkSafe BC in the following 3 classification units, then you're our members. So counseling and social services, life and job skills training, residential social service facility. We are interested always in hearing from you, our members. We'll be sharing a survey with you next month to gather additional information into violence prevention, the training and services you would like to see from us in the future. And your feedback is important to us as we build this organization into a support service for the social services sector. As we get started, today on the agenda, we'll talk a little bit about what violence means, how to define it, what it means to have a violence prevention program, and why you would want to create one. We're going to talk a little bit about the worker-centered approach. We'll also take on a journey on one employers into violence prevention and the behavioral assessments they have done and keep doing in their organization as an example of what could be done in the sector. And we're going to finish the webinar with a post-incident follow-up and what to do, what the steps are. We had a lot of content for this webinar, so we decided we would want to split it up into 2 sections. We're going to have a part 2 later on in April or May, where we'll talk about violence risk assessment and training specifically that we're building for the sector. As we get started on this topic, one question I really want to reflect on is, what type of training are you currently providing in your organization? So if you have a moment, please type in the chat so that we can kind of gather this information as we build our own health and safety training with respect to violence. As you know, the psychological injury claims and injuries in this sector has been growing exponentially. And what we see now is that residential social service facility, so one of our classification units, is now the second highest number of claims and injuries, only second to paramedics. Now, violence is only one of the contributing factors to these types of claims. And so we really want to understand it a little bit better and put in strategies in order to address this exponential growth in these types of injuries. We'll also have a conversation on psychological health and safety and mental health and talk about the strategies that the Health and Safety Association is putting in place to tackle some of these issues. That webinar will be happening in April and it will be posted on the People Working Well website. So go there and register, please. And as we tackle this topic, I'm going to pass it on to Geri, who is going to talk about defining violence.
Thanks, Tigran. My name is Geri Grigg. My pronouns are she, her, and I'm delivering this webinar from the unceded traditional territories of the Coast Salish Nations, Tsleil-Waututh, Squamish, and Musqueam peoples. And just as I approach this work, we approach it with a sense of humility, constant learning, constant improvement to honor some of those values. And so in terms of continuous improvement, I just noticed that the place I work for is actually wrong on the initial slide. It's like doing a final paper. As soon as you hand it in, you notice a mistake. It's actually the Hospital Employees Union. And Hospital Employees Union has members across the community social services sector. So how do we define violence? WorkSafe, of course, does it very technically and legalistically, the attempted or actual exercise by a person other than a worker of any physical force so as to cause injury to a worker, and includes any threatening statement or behavior, which includes a worker gives a reasonable worker a reasonable cause to believe they're at risk of injury. So that's included in the occupational health and safety regulation. More commonly, violence includes spitting, hitting, kicking, shoving, yelling, verbal threats, intimidation, as well as expressions that are universally understood to indicate harm, such as moving your finger across your throat, mimicking a gun with your hand. At this point, the legislation does not include staff-to-staff violence, which is covered under bullying and harassment regulations. WorkSafe has been consulting for a number of years to expand the definition to include staff to staff, including leaders to frontline staff, but at this point it's still in consultation. So included in the definition of violence is domestic violence, and so when you build your violence prevention program, you should be also assessing the risk for domestic violence, and also training staff at all levels to recognize and respond to domestic violence. So why do we need violence prevention programs? Any worker who deals with people, including clients, patients, residents, participants, and their families, or their loved ones, faces a risk of violence. So this includes almost everybody that's working in the community social services sector, which is not actually a statement on the folks that are served in this sector, but rather a recognition that the situations arise in the services that you provide to people, that they come to you perhaps anxious or scared, have a history of exclusion, or ill or in pain, seeking treatment. And those factors would make anybody have more likely to commit violence. So just kind of in summary, we all have situations that arise in everyday life, and sometimes they become overwhelming. They overwhelm our ability to cope, and that can result in violence for almost anyone. So the good news is, while violence is predictable, it's also often preventable. And so there's a system, the establishment and maintenance of a program to stop the violence, to minimize violence, to minimize the risk of violence, is guided by the following priorities. Next slide. Worker safety first, client safety second, corporate protection third. So at first, we may think about, it should actually be client safety first, because that's who we're providing services to. But if you look at worker safety first, your clients then actually get the services, because staff cannot possibly deliver high quality services when they're afraid of being hurt, or they have been hurt and they're off sick on a WorkSafe claim. So when we look at violence prevention program, it includes some key elements. It includes policy. So the organization wants to create a policy that says what they're going to do. And so one thing that we don't want to see in policy is a statement that says, we're going to comply with the Workers' Compensation Act. You don't need that, because you already have to. It's already a law. So it certainly could reference legislation and collective agreement language, but we really want to look at a policy that's inspiring, that's that's giving us something we hope to achieve, such as a reduction of all incidents of violence against staff at all levels of the organization, and everybody is doing their part. So take a look at your policy when you leave this webinar and just see, is it aspirational? Does it make people feel as though you're aiming to protect them from violence? Or does it just say you're complying with the act? We want to do risk assessments. They should be conducted as regularly as necessary. So the more changeable the environment, the more frequently you're going to be doing your risk assessments. So if you have outreach workers where the environment changes all the time, they want to do a rapid risk assessment at each time they respond to an incident. An office environment where not much changes, you only want to say, you know, if the population changes, the staff changes, maybe we want to do another risk assessment. We're going to have procedures, the procedures that must consider how the work is actually done. So if you look at a a procedure that is designed only when everything is ideal, then your procedure will actually probably fail and not be followed. So the next is worker supervisor training. Practice, 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 de-escalation. It helps to bring confidence to workers. And when workers have confidence, they actually are more cohesive, more trusting, and more violence is reduced just by their confidence level in being able to deal with it. We want to report and investigate incidents. Try to be curious when things go wrong. You will always find somebody who in your workforce who seems to be able to manage everything. Ask about what they do to make things happen well. In the event there is an incident, we're going to want to have incident follow-up and program review. I want to approach incidents to learn what happened, to make something go awry at that moment. So we all want to say it was because of this one thing. If this one thing didn't happen, it wouldn't have gone awry. But that's never the case. If we look to blame something or someone, we're going to create a culture of fear and mistrust. So when we look at those program reviews and those incidents, take blame off the table and approach it as though everybody was working to the best of their ability and did the thing that they were supposed to do and were rational at the time. Next slide, please. So most safety systems, we're going to go through some pieces of these. My co-presenters are prepared with more detailed information. They're usually built around compliance and data measuring. So if we have the data, if we know where the incidents happen, we can respond. But when you build your program and review your program, take a look at some more contemporary safety systems. They look at guiding us more on the principles of organizational development and human factors. They basically tell us that staff already know how to be safe. Employers need to learn to listen to the staff because they're the ones that are delivering the programs. The principles guiding your contemporary safety science are it's called HOP, Human Organizational Performance. Blame fixes nothing. Context drives behavior. Mistakes are normal. Learning is essential, and how leaders respond matter. So we're not going to spend an awful lot of time in this webinar on these concepts, but I'm sure you'll see them again in future webinars. But do think about your programs as you go through the rest of this webinar and think about how they are focused on the workers, how they are focused on keeping them as safe as possible, and how they incorporate their learnings in their day-to-day work, and make your program better. So I will now invite Kavita to introduce you to behavior care planning. Thank you.
Thank you, Geri, and passing it on to Kavita. And so she's going to talk about behavior risk assessments. And this is a different types of risk assessment. Oftentimes health and safety folks talk about violence risk assessment, which is a very prescriptive thing from the regulation. But the more important thing is when we're working with clients is to conduct behavior risk assessment. Thank you, Kavita.
Thank you so much, Tigran. And I think it's a great segue. Thank you, Geri, for just setting the stage for the importance of violence prevention. So I'm going to talk a little bit about the work we do at Possibilities. So I'm going to go, just give me a second. Okay, so as an agency, the population we support are individuals with disabilities across the lifespan. So to that end, we have a comprehensive range of services from housing, community inclusion, and behavior support, employment. So lots of different services and different levels of risk in different categories. So I'm essentially going to focus on Laurel Behavior Support Services, where we deliver behavior consultation across the lifespan. And on this slide, you'll see the different services. And as an agency, we are unionized and we have 491 members as part of BCGEU. And we supported a little under 2,000 individuals across the province in the last fiscal. As an agency, our program, the Laurel Behavior Support Services, is the one that's a regional service. All other programs are delivered here in the Lower Mainland. So give you a sense of just building the context of the work we're doing. So behavior consultation is offered across Lower Mainland, Fraser Valley, South and Central Islands, Sunshine Coast, and also the North and South Okanagan. And last year, we supported approximately 1,000 children, youth, and adults in the province. Now, we also have a complementary service, which is sexual health. And one of the reasons why I included this over here is that we do see some behaviors and some challenging behaviors associated with either sexual violence or sexual behaviors that we realize it's a gap in service. And so we have added that to our repertoire of skills, and we have some certified sexual health educators as a result of it. So to give you a sense of who we support, so we get almost most of our referrals come from, I would say 97% of the work we do is through government referrals from Ministry of Children and Family Development, and then Community Living British Columbia, which is for adults. And our focus, the reason they reach out to us is because of challenging behaviors and just the ability of people with disabilities to participate in their community, home, or school settings. Behaviors can come in the way of that, and that's when referrals come to us. And the kind of behaviors vary in severity, frequency, and intensity. But to give you a sense of the kind of behaviors that are listed on the referrals, it's verbal, physical aggression, self-injurious behaviors, property destruction, social skills, self-regulations that's coming in the way, or loss of employment as a result of not understanding personal boundaries, and various other behaviors associated with it. So as you can see, the importance of violence prevention is critical in the work we do, because we also work it's an outreach service. So we're actually going into families' homes. We are going into community settings with people who may be engaging in these behaviors. So it's very important for us to understand these behaviors and then come up with plans to address them. So as part of the work we do, I won't do a deep dive into it, just to give you a sense of the work that we do as behavior therapists and behavior consultants and analysts. We conduct a comprehensive functional behavior assessment. And what that essentially means is really shifting the focus from what the person is doing to understanding why it's doing, with understanding that the behaviors may be a means of communication for the individual in the context where they are. And so this includes a lot of different steps just to identify what's driving the behavior, what's the purpose, and then developing a plan that provides the staff strategies to address it, strategies to teach the right skills to replace those behaviors. It also goes along with a comprehensive risk assessment in terms of the understanding what's the impact of those behaviors on people around and on the person themselves. So trying to understand what does that look like, what changes can we do in the environment, or what's contributing to the behaviors in the environment, and also what's the staff capacity to support, what skills do they need. And once these plans are developed, we also provide implementation support and ongoing monitoring, so that it's not like one of those things where you have a plan done and it's a checkbox. We really do want to kind of be there involved to support that implementation piece and see if strategies identified are being effective and are resulting in some good outcomes. So for the purpose of this webinar, I think it's important to focus on what we do for safety and violence prevention. So as part of the risk assessment, once we gather all the information, we're really trying to understand the individual's escalation cycle. We're trying to understand what are some early signs of that the problem behavior is going to kind of move to an escalated state. So what are the precursor behaviors? And how can we address the individual or respond to the individuals in a way that we can prevent escalation to the next level? So the safety plan is a plan, or a de-escalation plan provides that level 1, level 2, level 3, kind of what those behaviors look like and how can staff respond to those behaviors to prevent further escalation or to help them move towards de-escalation if they are already in an escalated state. As you would all know, like, critical incidents are likely to happen when we're working with this population. And Geri mentioned it across the sector, there are so many different reasons that contribute to critical incidents. What we do, the way we look at critical incident is that every critical incident is a data point for us because it reveals really important information that we need to then take to inform what we do next in supporting that individual. So we do a gap analysis, trying to understand what are some gaps between what the plan said, how they implemented. Is it because the strategies didn't work? Do we need to make changes, or do the staff need more support in implementing? Or is it a matter of us clarifying some of what has been written, or or do we need to make some changes? So the data point is important because it really reveals what our next action needs to be in supporting this individual. So that was part of what we do as within Laurel. And as an agency, we're a fairly large agency, more than, as I mentioned, close to around 500 employees. We wanted to make sure that we also build their capacity to respond. And in housing programs, community inclusion programs, employment, and assisted living, all of those programs. So we do have 3 pillars that we lean on. One is the person-centered thinking module, positive behavior support, and the MAN system. So I'm just going to walk you through them briefly. The first 2, I was involved in developing the first 2 for the agencies, and I can speak to the 7. Like for the first one, the person-centered thinking tools, we have 7 tools that we review with all the staff. It's a 4-hour training, and it's a training that all staff go through within our organization. Essentially, the word person-centered is used in a lot of our literature within our sector. But what we wanted to do was to unpack it, to understand what does that really mean in everyday work with individuals we support. Like, how can we ensure they feel the sense of choice and control we offering them, supporting them with dignity and respect, all of those things, how can we kind of weave it into every interaction we have with them within our agency? So, for example, things like, balancing important 2 and important 4. Within our sector, we do a lot of focus on safety, and sometimes staff can lean very heavily to what's important for you. It's very important for you to do this, like, that it's very important for you to lose weight, or it's very important for you to eat healthy. Whereas the person who's got the disability, who has capacity to make their own choices, may be interested in doing something else. So when there's a push and pull like that, and there's loss of control, it could give rise to challenging behaviors. And we see that quite often within our sector. So giving them tools of how to navigate these conversations while not taking away control from people with disability is really an important part of the work we do. So that's just an example, but this training goes deep into each of them. It's interactive. It's got lots of videos and group exercises that help them understand each of these concepts. The second training that we offer all staff within Possibilities is on positive behavior support. It's a foundational course, again, and it's not to say that they have to develop plans at all. It's really to help them understand that when they see behaviors, that there is a context that informs why they're doing what they're doing. So really trying to get them to focus on why rather than what they're doing. So, oh, he's aggressive, or he is, very non-compliant. There are people, you see all these words being used, but and we want people to move away from those but really look at it from a human sense. What is going on? What's driving this, and how can we support them? So this training walks them through that process and orients them to a range of preventive strategies and teaching strategies that they can implement. And the goal is to catch behaviors early and not let it become very critical. So these strategies can be implemented as they start seeing some challenging behaviors surface, really having that analytic lens to understand them sooner than later. Then we have the MAN system, which is, again, very similar to other systems that are in place, which is the nonviolent crisis intervention. Some of you added that in the chat when that question was asked. It is also an evidence-based approach to crisis prevention, verbal de-escalation, and it also has a component of physical intervention, which may include things like how do you position yourself? How do you release if somebody's grabbing onto you or biting you or pulling your hair? How do you release that? Or how do you maintain safety while trying to transport a person, right? So all training, all staff go through a 2-day training, and some of our staff go through a 1-day training based on the scope of work they do. If they have limited interaction with individuals with complex needs or complex behaviors, then they may go through just a 1-day training. Some of the outcomes we have noted as a result of this, it started in 2014. We've definitely seen an increase in staff confidence, and this has been noted in our surveys that we have put out year after year. We've seen a shift of focus from safety only to skill building. We've seen decrease in challenging behaviors, critical incidents, and reduced cost in lost time and injury, which Tigran had mentioned when he showed that slide on data, that aggressive behaviors and violence is really an important contributor to this lost time and injury within our sector. So we believe like it's really improved the overall quality of the life of individuals and the experience of staff supporting them. So they're not coming from a fear sense, even if they have the necessary skill to support them. And this is the data we have. So, and you can see our claims cost history shows that injuries due to aggression violence were the highest contributor as well within our sector. And you can see that there's been a steady decline in our premiums throughout since we started this. And I don't want to take that this was the only thing that contributed. We've also had many other measures in place in terms of building the staff knowledge about safety procedures, and opportunities to review incidents within our ARSH committees and all of that. But it's been a good journey, and I want to open it up for questions. But I do want to say to people that it would be really great as a reflection to think about what people are doing within their own organizations to kind of prevent violence when you're working with the population, but also how are you measuring impact in some ways? How have those tools helped or not helped? I'd be curious. Maybe it's a conversation for the next time. I'm going to stop sharing right now, Tigran. I think you're taking it back on.
Yeah, thank you, Kavita. So if you don't mind to answer Kavita's question in the chat. So what are some systems you have in place in your organization to proactively address challenging behavior that staff are likely to encounter? So I'm gonna, as we switch to the presentation with Farzad, I'm just gonna ask you to pause for a moment and think through that question, reflect on it, and enter into the chat. So off to you, Farzad, as you start talking about post-incident follow-up.
Thank you, Tigran, and thank you, Kavita, for your presentation. And you touched on a lot of important points, including critical incidents and critical incident support, which I'm going to touch on in my presentation as well. Before I start my presentation, I also want to ask a reflective question and for the chat, and that is, as I go through my presentation, if there's elements of my presentation that you think you need more support with, so if it's reporting, if it's conducting investigations, if it's seeking out post-incident resources such as critical incident support or EFAP, I'd like you to please, if you would put it in the chat, and that will just help us sort of realize where the gaps are. So content for my presentation, we're going to be talking about using post-incident support and resources, reporting of incidents and investigations of violent incidents. We're going to be talking about updating and communicating violence risk once a violent incident has occurred. And we're going to be talking about reestablishing relationships between employer and the worker. Next slide, please. So before I start this slide on critical incidents, I want to maybe preface this by saying that there has historically been a link between psychological health and safety and violent incidents. And we all know that violent incidents and the runoff from violent incidents don't just include physical harm, but they also include psychological harm. And realizing that and realizing the strategies in which we can deal with critical incidents requires that those two factors are interlinked. The definition of a critical incident is an event that may cause individuals to experience strong reactions and has the potential to interfere with their ability to function effectively, either at work or at home. In fact, and in many critical incidents, we see a significant decline in cognitive function due to depression, PTSD, and due to a lot of other mental health effects that can stem from violent incidents. The important thing to note with critical incidents is that they may produce symptoms that can manifest themselves days, months, or even years after the incident. So just because a worker doesn't exhibit symptoms right after, in the hours leading up to or following a violent incident, doesn't mean that they will not develop a mental health condition, perhaps days, months, or years after the incident. And so it can be quite challenging to, I think, first pinpoint cause and effect between violent incidents. And a lot of the times workers are dealing with effects that they themselves are trying to understand. And so the importance of check-ins from managers and supervisors to workers from a supportive perspective, just to check in on, hey, what's going right? What do you need more support with? That can really go a long way towards making a worker feel comfortable and making a worker feel like they're in a supportive environment. So I would encourage all of our managers and supervisors today in the presentation, take a good look at their own care plans and realize that these violent incidents have an effect, whether it's physical or psychological, after the incident. Next slide, please. So the reporting process itself, there is a heavy burden on the importance of reporting to your supervisor and employer, even if there is no injury. So for workers, there is two options. So basically, you can call WorkSafe line and teleclaim your incident, or you can fill out a WorkSafe BC Form 6. That's the employee report. The other report is actually prescribed by regulation. It requires a 72-hour timeline for employers to report incidents that require medical assistance, whether that's a physical or a psychological incident. The importance of reporting, even when there is no injury, is prudent because there is a likelihood, and obviously this is rooted in claims research, but there is a high likelihood that if you report the incident, even when there is no injury, that you're going to have a high likelihood of acceptance, as opposed to if you did not report the incident or if there was a delay in reporting the incident. So the chances of success on acceptance of claims especially rises due to the timeliness of reporting incidents. Next slide, please. So the regulatory requirement to conduct reporting, investigations, and follow-up are all prescribed under Section 69 and 71 of the Workers' Compensation Act. Specifically, when you're thinking about investigations, it's important to recognize that the Section 69 and 71 both prescribe that preliminary investigations occur within 48 hours of the incident, and those are normally rooted in prescribing short-term corrective actions from the incident followed by a full investigation, which is required 30 days, within 30 days of the incident, and usually are rooted in longer-term corrective actions. I will preface this by saying I thought Geri did a good job of laying out the human organizational performance aspect to investigations, and that's really looking at work, the context of work, how it happens, listening to workers, integrating their feedback, looking at work from the ground up instead of the top down. Those are really crucial aspects, and unfortunately, we don't have enough time to cover the HOP principle in its entirety. But I do think it's an important principle to keep in mind when you're looking at investigations is listening to workers, understanding the context of their work will really help to provide more fruitful investigations. The other important aspect of reporting is that it allows for the updating of violence risk assessments and helps inform other workers in the department of risk. So that is important in itself. It allows for the risk level for a particular area to be changed if there is a violent incident, which is also required by regulations. So when a new hazard is introduced into the workplace, it's required that the risk assessment be updated and that there's communication and awareness to other workers as well. It also helps to prevent future incidents of violence through implementation or corrective actions. And if those corrective actions are effective, it really helps to, if you look at the hierarchy of controls, helps to eliminate future incidents of violence as well. Next slide, please. So using post-incident support and resources, seeking first aid resources for physical and or psychological injury. So looking at your mental health first aid resources, it's important that the same way that we look and conduct risk assessments for physical injuries in the workplace, and the same way that we would decide how many first aid attendants we need for the site or locations or such, we do the same thing for psychological injuries, right? And that's the same thing if we need more than one mental health first aid attendant. That's something that should be prescribed into your risk assessment plans. Critical incident support resources, looking at your EFAP program, seeking counseling services. These are all post-incident support and post-incident resources that should be important to communicate to your workers. And it becomes even more important to offer these resources in the hours or day after the violent incident to make sure that employees are getting the support that they need. Next slide, please. So assessing the incident and putting in place immediate safety measures to prevent reoccurrence is probably the cornerstone of any good occupational health and safety program and any good occupational health and safety investigation. So when we are looking at determining root cause from an investigation and we're looking at assigning short-term and long-term corrective actions, we are hoping that these corrective actions are effective in reducing the reoccurrence. So whether we need to bring in experts from different departments, whether we need to bring in third parties to ensure that we have a fruitful investigation, one that takes into account the risk of reoccurrence occurring, we need to make sure that we have the correct investigation and post-incident communication so to make sure that reoccurrence does not occur. We also check in with workers to make sure they're supported in taking adequate time off to recover, helping workers to access support resources when they need it, and ensuring that all required reporting and documentation is complete and that it complies with regulation as well. Next slide, please. In summary, for my presentation, it's just crucial to understand the requirements of reporting, the requirements of conducting good and fruitful investigations, and integrating a worker-centered approach and hopefully a human organizational performance approach, which unfortunately we don't have time to get into today, but I think it is very effective in terms of making sure that reoccurrence is limited. Thank you for your time.
Thank you, Farzad. And so we are now at the stage of like the having some opportunity to ask questions. So I'm gonna open it up to the group. I see you have one question came in. So of course, it's the logistics. Will the presentation be emailed? Yes, we will email the presentation out after this webinar. And any other specific questions?
There are two questions in the chat. One is, when a CI is received, there is a duty to investigate. There may or may not be an injury. When there is a worker injury or near miss, there is a duty to investigate. Do organizations use the same forms for each, and do they do two investigations when there is both a CI and injury, one for internal and one for external compliance?
So did you want to tackle Kavita?
Oh, I was just going to say, when these incidents happen, we do ask them if they are involved in a critical incident. The staff, they do one form, and then I don't believe they do two. They do a DMI form to and there's an investigation that is followed up by our OSH committee to identify what are some risk mitigation strategies that can be put in place. And we do have a safety talk if it's a near miss. We do have a form where we kind of connect with the staff and kind of talk them through how they could have approached it differently if they were in a similar situation in the future, and review those strategies with them. I don't know whether that answers your questions, Yancy. No, sorry. Is that, yeah, I think it was a question for Farzad though. So I may have jumped in. Farzad, maybe you want to take that on?
Yeah, no, I was just going to say with internal and external compliance with respect to investigations. So investigations with full investigations with WorkSafe BC, there's a requirement that they get those types of investigations would get sent into WorkSafe BC. And so if the question is, can I use the same form to conduct a full investigation internally and externally? Because WorkSafe BC has templates that you can use for full investigations. That's completely fine if you have an internal form that matches what a full investigation would represent with WorkSafe BC, as long as it has the same criteria and the same requirements for a full investigation, though that is fine. That would be acceptable under regulation.
Yeah, I think the question is really around like efficiencies in some respect, right? Like the WorkSafe BC is very prescriptive in terms of what they want to see on an incident report and an incident investigation. And so you really want to align your internal and external as much as possible. Of course, there's different systems. When you're doing a critical incident, you might look at it from a client perspective as well. So you might be collecting other information. So we generally want to make it as easy as possible. So like looking at from the organizational side, how to align those elements would be beneficial. And yeah, because the WorkSafe piece is just very prescriptive from the regulation, and they'll give you an order if you missed an element and submitted a sort of like an investigation that didn't meet all their little check boxes. So it's something you want to minimize chances of happening.
Yeah, thanks, Stuart. And I'll just add one more element, and I think this centers around privacy as well. When you're conducting investigations and putting down confidential information, there has been a stance by WorkSafe BC in the past month that says that they will not be sort of accepting any investigations that come in that have a psychological health and safety element to them. So if they contain names or if there's confidential information, they've provided the stance that they will not be accepting those because it violates their own privacy agreement and in having it on the WorkSafe portal. So if you do come across that line, or if you do get feedback from WorkSafe BC that you need to maybe change your investigations to not include things like personal names or events or maybe conditions, diagnosis, that may be something that you will face running up to it, because we have had feedback from WorkSafe BC on that front. That's something to keep in mind.
Thank you, President. And I think maybe we have a question for Kavita there. So I see you've the program that had possibilities may suit agencies that work long-term with individuals, but does not match the needs of organizations that operate shelters, housing for high-risk individuals, and for outreach workers. So any suggestions, Kavita?
Well, I know that it may not, I mean, I think there's some elements of it that would really work well because we do work with people with disability who are also sometimes intersecting with are in high risk situations, are in shelters or difficult, and our outreach workers do go out and support them and the staff that are working with them. And so there are some elements of behaviors that we still like we support the staff in understanding how to approach them, how to build a relationship. Sometimes that's really at the foundation of it when there's individuals who don't trust the social services and their intersection results in a lot of these challenging behaviors. So when we support individuals, some of the programs like positive behavior support, person-centered thinking, those tools can really inform how we look at these behaviors. What are the contexts in which they're happening? What are some key triggers that can result in that trigger the behavior? So we still give them some tools. Obviously, the approach is very different and compared to people who are living in family settings or in staff resources and community inclusion, where there's a regular staff and they have a place to go, they've got a schedule. So it does look different, but there are some elements that are transferable to those settings. But I hear you when you say that it doesn't necessarily match, the entire context of it. I do see one more question from Teresa, if I could just quickly respond to that. Can you share more information about behavioral assessments? A behavioral assessment really involves looking at the challenging behaviors, seeing what comes before, what comes after, like what's the trigger to the behavior, what sets the person off, and trying to understand if there's a pattern to that, and trying to understand all those triggers that could result in this person starting the escalation cycle or getting agitated. And so that's what a behavioral assessment also focuses on, what's triggering, but it also focuses on what purpose is the behavior serving. So for example, if the person gets agitated in a crowded space, he engages in the behavior and the staff take him out of the crowded space. So it's serving the purpose of escaping a crowded space. So if that is the pattern that the person's got involved, that's what he's got used to, then that purpose is served, that agitation is serving as a way to get out of a crowded space, especially when they are not able to communicate verbally. This could be their only adapted way of getting out of a situation. So trying to understand, that's just one example, trying to understand those behaviors, what purpose it's serving, and then trying to give them a better way or a more safer way of communicating that, maybe through verbal, through text, or visual, or gestures, any kind of a novel way that the staff could know that he's getting agitated, he wants to leave that space. So that's just an example to give you a sense of what behavioral assessments would involve.
I have another question in the chat here, and it's for you. So what is? Oh, sorry, Geri.
Sorry, Tigran, I didn't want to leave the one about the shelters quite yet, if that's okay. I just wanted
Yeah,
That's
go ahead.
perfect. Please do. Yes.
Just circle back quite quickly to thinking about that. If you ask your workers, you will actually find out. I don't mean to be flip when I say that. It sounds a little bit like a bit flip, but I don't mean to. You'd be surprised if you go to a shelter and outreach. They will give you amazing pieces of information. So just an example, when I was working with some members once and just throwing out general things about violence, and they said, you're not a patient care provider, yet you nailed it. It's right before lunch when violence happens. And so that's really your best strategy in this case, is to find out what the workers are seeing and what the workers experience in those settings, because they are highly changeable, highly volatile. But you will find some general themes, and then back to practice, practice, practice those de-escalation techniques so that people are confident and willing to call for help if they need it. So just spending some time with those workers and asking them the questions will actually give you some amazing insights into how violence happens.
I think thank you, Geri, for saying that. And one of our tools we use when people go into outreach into these sessions in these service sector is we do a pre risk assessment. So they assess the environment, they assess what's in the environment, what's going on, and they write that down, and there's a review of that to make sure that we have some risk mitigation strategies in place. And sometimes we have to meet outside in a different setting. Maybe we have to go at a certain time of the day versus, morning or evening. So adjusting the time of the day when you go in, the most optimal time for, low risk environments, that's the time to go in. So I think those are simple ways of also kind of seeing how some of these strategies could fit into these settings. So thank you, Geri, for just jogging that's one tool we use for outreach workers.
Yeah, I've also seen, although I just wanted to say something quickly, but apparently not. I won't let that last question be not get its due. But while we don't want to use public safety techniques here, like policing tools and those kinds of things, they do actually have these situations where they go into where the environment is unknown and the client is unknown, and so even a reach out to some of your public safety folks to say what are your quick assessment tools, your point of your point of care risk assessments. They may not call them that, but they will have a risk assessment that for years, decades, centuries, they've been going into these places where the risk cannot be known until you get there, and so it may be worth a reach out to some of your public safety folks to say, do you have any of those quick rapid assessment tools, and then maybe take them back, adapt them for your workplace.
Thank you, Geri and Kavita. I see one more question. So what is the training called for your person-centered course and behavior support? Who created it, and was it created by your agency? Can you tell us a little more about that, Kavita?
Yes, we created it. So I was involved. So I did create both the modules. It's gone through some iterations as we go along. We do deliver it to various agencies in the North and South Okanagan and sometimes here. So we've not done a real push on it, but we are open to delivering it to different agencies as well. And so that's definitely something we've done. And we also trained some of our team leaders on an RBT program, which is the Registered Behavior Technician program. So they took over some of the person-centered thinking training once I did it for 2 years, and then they are currently delivering it for the staff within our organization. That's right. Yeah.
Thank you. And another question from a participant. So when I have a critical incident, I often get pushback from staff about providing information about this incident because of client confidentiality. This often prevents me from making any meaningful recommendations for corrective action. How do other people navigate that? Any advice? I guess it centers around sort of having a culture of reporting and a culture of like learning at your organization to kind of get people to share. Like we want to have if you have a psychologically safe environment where people are comfortable reporting because they see it as a learning opportunity, but it will probably take time to be able to create that structure. And so you as a leader do have that opportunity, but it takes building trust. So it's not an easy exercise. So those are just some initial thoughts that come to mind. Anything else, Kavita or Geri?
I would just wonder about reframing the questions. So it's about there could be there are privacy aspects in whatever work you do, and you'd be familiar with those according to your organizational policies, practices, etc. But when somebody is violent, something has troubled them. And so really to care for that trouble is to care for the client. And so if we reframe it to say the person was distressed, and I'm going to use the term acted out, it's probably not the appropriate term in this situation. Let's look at what was happening in that event and reduce the stress on the client, family member, etc., so that we can then protect the staff. So it's about not blaming the perpetrator. They behaved in a way because something was distressing them. So reducing that distress in whatever way we can is the goal of the agency, but also meets the staff safety goal as well.
Thank you, Geri. I think Teresa had her hand up. Teresa, did you want to ask a question? I don't know, maybe it's not in this format.
Tigran, there's one that sort of goes into critical incident response as well. I answered it, but I just wanted to maybe say it publicly for the rest of the chat. The question came from Siamak, and they asked, have you ever used critical incident response service offered by WorkSafe BC? Is it free of charge, and how was your experience? So my answer, hi, I've used the critical incident response service from WCB, and the feedback I have got from members is that it has been, for the most part, effective. The service is available up to 3 weeks following a critical incident. You don't need to have an active or ongoing claim to use the service. The contact information is, you can call the line toll free at 1-888-922-3700. And the hours of operation are 7 days a week from 9 a.m. to 11 p.m. And if you do find that you need to file a claim after using the program itself will notify the respective claim services and file a claim accordingly. So good question, Sima.
And keep in mind that that service is independent of the prevention side, the officers that issue orders or things like that. So it is independent of groups. So you're not at risk there if your staff are using that line. In fact, WorkCBC, the critical incident service, is encouraging you to call them and utilize that free service. We have a And we have one question from Yancy. What is recommended training time to focus on health and safety and violence and follow-up recommended for the sector? How much per FTE, how much time should be dedicated to training? It's a good question. Kavita, any thoughts on
I don't know the ratio. I know somebody asked me about how one of the questions that I answered first, which I didn't bring it forward to the whole group, was how do you manage, where do you get the funding for the training that you do for all the staff? And I think my response to that is that we've carved out a training budget from our MCFD CLBC funding for all the training. And I think there's a justification for that. All our policies request, ask us to have staff that are trained in some of these things. So I think it makes sense to that's how we've aligned our trainings for the staff. But in terms of this question about what's the ratio for per FTE, it's a hard one. It's a hard one. I think it also varies depending on which location, who you're supporting, intensity of behaviors, all of those things, at least within Laurel. We have some FTEs that take up a lot of time because there's high critical incidents with people they're supporting, debriefs, all of that. We are wanting to make sure they're doing okay. Lots of check-ins, but there are others who are not. So it's pretty variable.
Thank you. Yeah, so I just noticed that we're at time, so I just want to say what's next. So thank you everybody for participating on today's webinar. I know you probably have other meetings to go to, so I just want to wrap this up in a minute. We will have a part 2 violence prevention strategies where we'll talk specifically about violence risk assessments, the compliance factor with WorkSafe BC, and we'll also try to tackle training in a little more detail. We also have a violence risk assessment online course getting set up right now. It's going through a review phase with advisory panel and our community of practice, and will be published in a month or two. And then we will also have some violence risk assessment consulting. So we hired a couple of safety advisors right now, so we have more capacity to support organizations with VRAs. And we are working with Switch BC, collaborating them on a violence prevention online training course. So those are all new things that are coming within the next May or June month. So exciting things are ahead. And thank you all for joining us. And thank you to Kavita, Geri, and Farzad for being part of this webinar. And see you all soon.